Imagine feeling exhausted, breathless, and frail, struggling even with the most basic tasks like climbing stairs or going for a short walk. Today we embark on a captivating journey into the realm of pulmonary hypertension, an intriguing and potentially hazardous condition that knows no boundaries of age. I am your host, and together, we will unveil the significance of early symptom recognition, the concealed perils it presents, and the transformative treatments that hold the power to change lives. Welcome to our channel, where we shine a light on a condition that often goes unnoticed but can have devastating consequences if ignored: pulmonary hypertension. Regardless of age, this condition can affect anyone, making it crucial to recognize its early symptoms, understand the risks involved, and prioritize early diagnosis and intervention. Pulmonary hypertension arises when the heart struggles to pump blood into the lungs, depriving the body of vital oxygen. Its initial symptoms are often subtle, easily mistaken for fatigue or poor physical condition, leading to delayed diagnosis and unnoticed progression. Did you know that an estimated 25 million people worldwide are affected by pulmonary hypertension? According to research published in the European Respiratory Journal, the global prevalence is approximately 6% of the population. These staggering numbers highlight the significant impact on individuals and families. Fortunately, early recognition and prompt medical attention hold the key to a successful outcome. A study in the Journal of the American College of Cardiology revealed that early diagnosis and treatment significantly improve survival rates and quality of life. If you've experienced unexplained fatigue, breathlessness, or mild chest discomfort, this video is for you. Join us as we explore the causes, hidden dangers, and effective treatments of pulmonary hypertension. Various underlying causes contribute to pulmonary hypertension, including genetics, exposure to toxins, medications, and coexisting heart or lung diseases. Identifying these causes is crucial for targeted treatment and management. Failure to intervene can lead to severe complications such as heart failure, arrhythmias, and premature death. Advances in medical science have paved the way for life-changing treatments. Medications that relax and widen blood vessels, as well as lung transplantation for severe cases, aim to improve symptoms, slow disease progression, and enhance the quality of life. Remember, knowledge is power, and together, we can ensure no one overlooks the early warning signs of this potentially life-altering condition. Let's dive in and unravel the mysteries of pulmonary hypertension. What is pulmonary hypertension? Before we delve deeper into the world of pulmonary hypertension, let's start by understanding what it means. Pulmonary hypertension is a condition that occurs when the heart faces challenges in effectively pumping blood into the lungs. It leads to increased pressure in the pulmonary arteries, which are responsible for carrying blood from the heart to the lungs for oxygenation. Diagnosis of pulmonary hypertension. To determine whether someone has pulmonary hypertension, doctors rely on a specific diagnostic procedure: measuring the blood pressure in the pulmonary artery. The pulmonary artery is the major blood vessel that carries deoxygenated blood from the heart's right ventricle to the lungs. By measuring the pressure in this artery, healthcare professionals can assess the efficiency of blood flow to the lungs. Normal versus elevated pressure. In a healthy individual, the pressure in the pulmonary artery is usually no higher than 25 mm of mercury, mmHg. However, if the measured pressure exceeds this threshold, a diagnosis of pulmonary hypertension can be made. It's important to understand that the higher the pressure, the more severe the pulmonary hypertension becomes. Elevated pressures indicate that the heart is working harder to push blood into the lungs, causing increased strain on both the heart and the pulmonary arteries. By diagnosing pulmonary hypertension through pressure measurements, healthcare professionals can better understand the extent of the condition and develop appropriate treatment strategies tailored to everyone. Remember, if you suspect that you or someone you know may have pulmonary hypertension or are experiencing symptoms like fatigue, breathlessness, or chest discomfort, it's crucial to consult with a healthcare professional for a comprehensive evaluation. In the next segment, we will explore the symptoms associated with pulmonary hypertension, helping you recognize the early warning signs that should not be ignored. Symptoms of pulmonary hypertension. Early stage symptoms. In the early stages of pulmonary hypertension, the symptoms can be quite nonspecific and easily overlooked. Many individuals attribute them to normal fatigue or being out of shape. However, it's essential to pay attention to these subtle signs as they can be the first indicators of an underlying problem. Some early stage symptoms of pulmonary hypertension include: Number 1. Fatigue. Feeling excessively tired, even after minimal physical activity or rest. Number 2. Weakness. experiencing a general sense of weakness and decreased stamina. Number 3. Mild breathlessness. Noticing increased shortness of breath or difficulty breathing during physical exertion, such as climbing stairs or walking short distances. Progression of symptoms. As pulmonary hypertension progresses, the symptoms tend to become more noticeable and can impact daily activities. What may have initially been mild breathlessness during exercise can evolve into more frequent and severe breathlessness. Other symptoms may include: Number 1. Breathlessness during less strenuous activities, feeling short of breath even with simple tasks like getting dressed, cooking, or walking short distances. Number 2. Breathlessness at rest, having trouble breathing, even when at rest or lying down. Additional symptoms. In advanced stages of pulmonary hypertension, other symptoms may manifest, indicating a more severe impact on the heart and lungs. These symptoms may include: Number 1. Chest pain, feeling discomfort, pressure, or tightness in the chest. This can occur during physical exertion or at rest. Number 2. Blackouts, experiencing fainting episodes or loss of consciousness due to decreased blood flow to the brain. Number 3. Dry cough, having a persistent cough that does not produce mucus or phlegm. Number 4. Exercise-induced nausea and vomiting, feeling nauseous or vomiting during or after physical activity due to the strain on the heart and lungs. Remember, experiencing these symptoms does not automatically indicate pulmonary hypertension, but if you notice persistent and unexplained symptoms, it's essential to seek medical evaluation. Proper diagnosis and early intervention can make a significant difference in managing pulmonary hypertension and improving quality of life. What are the dangers and complications of pulmonary hypertension? Number 1. Right heart failure. As pulmonary hypertension progresses, it strains the right side of the heart due to increased pressure in the pulmonary arteries. The right ventricle, responsible for pumping blood to the lungs, must work harder to deliver oxygenated blood, leading to right heart failure. This weakened right heart exacerbates the symptoms and complications of pulmonary hypertension. Number 2. Impact on blood circulation. With right heart failure, blood circulation is impaired. The weakened right heart hinders the flow of blood returning from the body, resulting in fluid accumulation, known as edema. This leads to swelling in the legs, ankles, and abdomen. Edema serves as an indicator of the condition's severity and the urgency of seeking medical attention. Number 3. Late-stage diagnosis. One of the significant challenges in managing pulmonary hypertension is the potential for late-stage diagnosis. Due to the nonspecific early symptoms and lack of awareness, the condition often goes undetected until it has progressed to an advanced stage. Number 4. Reduced treatment effectiveness. Treating pulmonary hypertension becomes more challenging in advanced stages. Early intervention provides better opportunities to manage the condition and slow its progression. However, as the disease advances, treatment options may become limited, and the effectiveness of interventions may be reduced. Number 5. Impaired quality of life. Late-stage pulmonary hypertension can severely impact an individual's daily life. The increasing severity of symptoms, such as breathlessness and decreased exercise tolerance, can limit physical activity, leading to a significant decline in quality of life. Number 6. Poor prognosis. Unfortunately, a delayed diagnosis of pulmonary hypertension is associated with a poorer prognosis. Without early intervention and appropriate management, the condition can progress rapidly, leading to further complications and an increased risk of mortality. These dangers and complications underscore the critical importance of early detection and timely medical intervention. Recognizing the signs, seeking medical evaluation, and receiving a proper diagnosis are essential steps in effectively managing pulmonary hypertension and improving long-term outcomes. Causes of pulmonary hypertension. Number 1. Left heart disease. One of the primary causes of pulmonary hypertension is left heart disease. Conditions like heart failure or issues with heart valves disrupt blood flow. When the left heart fails to pump blood effectively, it increases pressure in the pulmonary arteries, resulting in pulmonary hypertension. Number 2. Lung conditions. Several lung diseases can contribute to the development of pulmonary hypertension. Lung diseases like COPD, emphysema, and lung fibrosis can cause pulmonary hypertension. These conditions increase resistance in the pulmonary arteries, straining the right side of the heart. Number 3. Mechanical obstructions. In some cases, mechanical obstructions can impede the flow of blood to the lungs, resulting in elevated pressure. Mechanical obstructions like blood clots, tumors, or scar tissue can cause elevated pressure in the lungs. These blockages force the heart to work harder, leading to pulmonary hypertension. Other underlying conditions. Various underlying conditions or factors can also contribute to the development of pulmonary hypertension. These include: Number 1. Congenital heart diseases. Certain congenital heart defects, such as atrial or ventricular septal defects, ASD or VSD, can disrupt normal blood flow and contribute to the development of pulmonary hypertension. Number 2. Chronic kidney disease. Kidney dysfunction can lead to imbalances in hormones and fluid retention, which can affect pulmonary circulation and contribute to increased pressure in the pulmonary arteries. Number 3. HIV infection. People living with HIV/AIDS have a higher risk of developing pulmonary hypertension due to the impact of the virus on the cardiovascular system. Number 4. Certain medications, toxins. Certain medications, such as certain appetite suppressants or drugs used in the treatment of cancer, as well as exposure to toxins like methamphetamine or illicit drugs, can contribute to the development of pulmonary hypertension. What are the treatment and management of pulmonary hypertension? Number 1. Treating underlying causes. Managing pulmonary hypertension involves addressing underlying conditions. Treating heart failure or repairing faulty heart valves can help if the cause is left heart disease. Similarly, managing lung diseases like COPD or lung fibrosis through appropriate therapies can relieve strain on the pulmonary arteries. Number 2. Medications. In addition to treating the underlying causes, several medications are available to specifically target pulmonary hypertension. These medications work by relaxing and widening the blood vessels in the lungs, reducing pressure, and improving blood flow. Number 3. Lifestyle changes. Alongside medical interventions, adopting a healthy lifestyle can play a significant role in managing pulmonary hypertension. Number 4. Regular exercise. Engaging in regular physical activity can improve cardiovascular health and enhance overall well-being. However, it's crucial to work with a healthcare professional to develop a safe exercise plan tailored to individual capabilities. Number 5. Balanced diet. Eating a nutritious, well-balanced diet can support overall health and help maintain a healthy weight. It's advisable to focus on consuming fruits, vegetables, whole grains, lean proteins, and limited amounts of sodium. Number 6. Avoiding smoking and excessive alcohol consumption. Smoking and excessive alcohol intake can worsen pulmonary hypertension and increase the risk of complications. Quitting smoking and moderating alcohol consumption are essential steps toward better management of the condition. Number 7. Supportive care. Living with pulmonary hypertension can be challenging. Support groups and counseling offer valuable emotional support and a chance to connect with others facing similar experiences. Supportive care plays a crucial role in coping with daily challenges and improving quality of life. Remember, if you or someone you know is experiencing unexplained fatigue, breathlessness, chest pain, or other concerning symptoms, it is crucial to consult with a healthcare professional. By identifying and treating the underlying causes, such as left heart disease or lung conditions, we can improve pulmonary hypertension outcomes and enhance the quality of life. On behalf of our channel, we encourage you to like this video and subscribe to our channel to receive more informative content about various health topics. By staying connected, you can stay informed and empowered to make better decisions about your well-being.